So there's two groups of women that I see come in. The first group is women who have experienced an acute incidence of violence. So they come into our shelter, they have obvious signs of a head injury like staples to the back of their head, bruising to their face, their eyes, or women who have been strangled. And so one of the things that's most common is seeing bruising and marks on their neck or the whites of their eyes being completely red as a result of the strangulation. What we know is that those women often get immediate medical care from a hospital. And I also feel fairly certain in saying many of these women don't receive anything beyond that. Often because they're low-income women, they lack access to medical care, but there isn't anyone providing them services for the short and long-term effects of having that kind of a head injury. And then for us as service providers, we have no information about what the possible extent of that injury is and what that means for that woman's long-term healing, how we should work with her, what kind of resources we can connect her to. And so there's an obvious gap in services. The second group of women are women who are coming to us sometimes following an acute incident or just for more ongoing services where they've been told they have a mental health diagnosis. They also experience a variety of other symptoms like headaches, nausea, vision issues, and they're just kind of told that these are their physical ailments plus a mental health issue. When we look and listen to their trauma history, we often find repeated incidents of head injury, strangulation, all things that might be connected to or intersecting with what's been called a behavioral health issue. And so I've often wondered, the folks who are giving those diagnoses to these women, are they listening to the full trauma history? Is there anyone doing an assessment for the possibility of an undiagnosed head injury? And then again, as service providers, we are operating outside of the context of any of that information, doing the best we can to provide support, but we don't have tangible resources to service those women either. One of the other gaps that we have as a community is that although sexual assault survivors have access to medical forensic exams, domestic violence survivors do not, unless they have been raped and report that rape in the context of the assault. And so being able to work with the Cactus Foundation to integrate these two pieces of the head injury assessment with a trained nurse examiner who can possibly also collect evidence from domestic violence victims, it provides a wraparound holistic model of care for people and also aids in prosecution, which is again one of the other challenges with domestic violence offenders, is being able to prove that an incident occurred. And in our field, the unfortunate truth is evidence equals injury. And so to the extent that we can find those injuries, we have a higher probability of being able to prosecute these cases. One of the gaps that I recognize we have as a service provider is knowing how to provide tangible services to women who are suffering from the impact of a head injury. We do the best we can. We often look for behavioral health services in the community because that's all we have access to, but the reality is we often don't know what we're even looking at when we're sitting with women. We just know there's a set of symptoms, a set of behaviors, and we don't have a tangible resource to really address that in the delivery of services. And so often we're going to provide emotional support and we're going to focus on really just fundamental basic needs. Do you have a place to live, access to food, some level of health care, but the ability to help people develop the life skills that they need to move beyond survival and basic human functioning is really what we've been put here for. And so being able to have this opportunity and resource with the Cactus Foundation and this project really would take our services to the next level as it relates to this population. If we were to look at that holistic wraparound model of integrating nurse examiners into this project, we'd also have to look at being able to expand the numbers of nurses that are available. Right now, it's a finite group of people, and the burnout rate is very high because of the nature of the kinds of calls that they take, the on-call nature of it, late hours, and just traumatic incidents that they work with. And so, again, I think as a community, this project gives us the opportunity to expand this resource in our community, which will have an impact on a variety of levels. I'd say on average 40 to 45% of the people in our shelter are children at any given time, and often they outnumber the adults. This group of children really struggle as it relates to educational attainment. A good number of them have learning disabilities, emotional issues. Sometimes they have experienced direct trauma themselves and have been abused in the course of what's gone on in their home. And so being able to provide them with a higher level of service and access to a different kind of service would be an incredible supplement to what we do now. At this point, what we do with those kids is refer them to behavioral health providers, hope that the school system is doing something to assess this with them, but I also worry that that's not being done in a consistent manner, taking into account their trauma. The other factor related is if their mother has experienced head injuries, and is struggling through her own daily functioning, being able to parent kids who are dealing with exacerbated issues related to their own behavioral health and functioning in school is a challenge. So I see this as a support for the entire family. One of the things that's important about that as it relates to head injuries is that we know that the types of actions that result in head injuries like strangulation, blunt force trauma, those kinds of things, they're also indicative of a higher level of risk for those survivors. So those are the people who may be more likely to be seriously hurt or killed. And so there is the immediate impact to their health and the long-term impact to their health, but there is also the ability to have a very specific conversation about the level of risk that exists in their relationship.